Okay, good morning everybody. Okay, what's happened in the postoperative time after LVAD implantation? Patients who return hemodynamically stable with minimal metabolic disturbance may be weaned from mechanical ventilation and walking within few hours. As if chest tube loss is minimal and rewarming has occurred, what we can do? Just keep calm and extubate. This is the routine postoperative care. But what does it mean hemodynamically stable and hemodynamic optimization in the early postoperative period after LVAD implantation? This includes maintenance of sinus rhythm, a mean arterial pressure between 60 and 18 millimeter of mercury, a central venous pressure less than 15 millimeter of mercury, a pulmonary artery wedge pressure less than 15, a cardiac index higher than 2.5, and mid arterial pressure below 19 millimeter of mercury, just to avoid impinging and in the output of continuous flow of the VADS machine to reduce the risk of stroke. This is a typical and stable hemodynamic situation after LVAD implantation in the few hours in the ICU. Another topic and another problem just to follow during the early phase of the post-op of LVAD implantation is anticoagulation therapy. It's important to remark that after CPB, it's important to complete reversal the heparin effect. And we can wait until the first day, postoperative day, just to start heparin infusion and anticoagulation. For the 24 hours, we can leave the patients without any anticoagulation, just to avoid any kind of bleeding. And the first two postoperative days, if the patient is stable, we can start with EV infusion of heparin, and the threshold must be between 14 and 60 seconds. After that, from the third days, if everything is stable and there are no bleeding problems with the patients, we can start with Warfarin and Aspirin administration, just to wean heparin infusion. But optimal performance of LVAD is guaranteed by heart and device interaction, as we saw during this morning in the previous presentation. What does it mean? This is what happened after LVAD implantation. Just before, as you've seen on the right, there is an decompensated patients with an increased pressure in left ventricle. After LVAD implantation, we want to reach this situation with a compensated situation from left and right ventricle. And this is the geometry of right ventricle. We talk a lot about right ventricle this morning, so I skip away. This is another example of optimal unload of the left ventricle. This is really important in the first few hours after LVAD implantation. We saw before in the previous presentation that if we have inadequate unloading of left ventricle, we see like in the first figure that there is a overdistension of left ventricle, and we can have also increase of arrhythmia, ventricular arrhythmia in the patients, and the patient is unstable. Excessive unload can lead a suction problem and right ventricle decompensation. So the correct position of low flow and the speed of the machine